really just making sure, like I said back when you had asked, what does public health mean for me, is ensuring that the system is working in favor of its end users, and obviously in this case it's our citizens. So how is emergency services, how is public health, how is environmental health, as individual systems working to working in the favor of the end user? They're not working in the favor of the end user if they're all tackling one issue, in this case disasters or climate change, from that what this standpoint, XYZ standpoint, or I in public health believe this is the best way to tackle this issue. Like, no, like there are a million different ways to lead to one outcome, right? So why can't we have all three of them uh, come to the table and work together? And that's what I mean. That's when you ask me about intersection, that's what I think about.
Hey friends, welcome to Public Health Careers. Join us as we dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies to help you learn, navigate, and transform your public health journey. I'm your host, Omari Richards, founder of the Public Health Millennial and host of Public Health Careers. On today's episode, we have Ajay Persaud. Ajay is a Climate and Crisis Preparedness Senior Program Associate at the National Network of Public Health Institutes. He seeks to advance public health disaster preparedness and climate change resiliency in underserved communities across the United States. Having a background in exercise science and emergency and the intersection with public health, he conferred a Bachelor's of Science in Kinesiology and Exercise Science at the George Washington University, then a Master of Public Health in Environmental and Occupational Health at the George Washington University. In today's episode, you'll hear and learn more about the intersection of emergency services, public health, and climate change, why diversity of experience and hearing nodes are important, journey from working as an EMT to focusing on prevention and populations to public health, and much more. Be sure you subscribe and share this with a friend. Enjoy today's episode.
Hi, this is Ajay Persaud, and I have the pleasure of currently serving as a Senior Program Associate in the Climate and Crisis Preparedness portfolio at the National Network of Public Health Institutes. And you're listening to Public Health Careers.
Hey Ajay, welcome to the show. I'm very, very happy to have you.
Likewise, thank you so much, Amari, for having me on the show. It's great to be here today.
Yeah, looking forward to digging more into your story. And as we get into your story, so like how do you identify and tell us a little about your personal background?
Yeah, definitely. More than happy to kind of give some background and why I'm here today. So, like I had mentioned, my name is Ajay Prasad. I'm a proud first generation Indian American here with both roots from India as well as the Caribbean, as the more recent generations of my family have lived in Guyana, South America before coming over to the States. Um, Proud New Yorker, born and raised in Long Island, New York. At which point, after graduating high school, I moved down to our nation's capital in Washington D.C. to pursue my education. From a young age, I was always interested in health and medicine, as both of my parents worked in the medical field. My mom in the hospital, my dad in the nursing home. So that really kind of jump started my interest. In all of this, in medicine and public health and in healthcare. However, what really got me going was during my time in high school, I started volunteering at my local hospital in the emergency room. So that was a really great experience, like kind of first experience in my mind in terms of just getting, hands on at work with the patients, kind of seeing how the emergency room runs and just all the things that go into making sure people are taken care of. So once I started working in the emergency room, I was like, hey, this is kind of interesting. This is pretty fun. What else can I do? So met with my local ambulance company, at which point they were looking for volunteers. So that's kind of jump started my passion, my career with emergency medical services, and the rest is honestly history. Kind of jumping ahead, I currently reside in Philadelphia, Pennsylvania, and outside of everything public health, I'm really passionate around sports, running, soccer. I try to do, local leagues, things like that, as well as I really enjoy spending quality time outdoors, either hiking or gardening. Shout out my green thumb from my grandpa. And lastly, if I can, serving in my local community, either through volunteering, community gardens, or local shelters, whatever kind of opportunities come up. I really have a passion for just volunteering outside of public health and trying to, you know, help the community out in other ways possible. So yeah, so that's a little bit about me. That's kind of my background, where I started, and kind of what led me here. But yeah, thanks, Amari, for having me.
It is my pleasure, and I'm glad to hear like all the intersections, all the different ways that you show up to the work, and just like bringing not only like your identity, but the things that you like and those passions, which I think are also important as we are whole beings, and it's important that we find spaces to express ourselves as whole beings in this work because, as we know, it can get tiring. Um, so I'll ask this question first because you started off as a volunteer in high school in the hospital. Was that something that you wanted to do? Like, how did that come up for you?
Yeah, definitely. I really was just kind of looking for opportunities to get my feet wet. I actually started as a volunteer in both the hospital as well as I spent, I think, that summer interning at a local law firm. So, really just trying to get kind of as many experiences as possible. I knew that I was really interested in the medical field, but I really want to see it firsthand, kind of experience it, be able to talk to all of the staff members. That's something both of my parents told me. It was like, if you have an interest in this field, like try to see what it's like the day to day, the actual, and hear from the people that are working in these professions. So that's exactly what I did. They had volunteer opportunities at the ER to bring patients back. So I didn't really do any like hands on or anything like that. Nothing related to patient advocacy or anything, but really just meeting people where they're at in terms of triage and bringing them back to their beds, while also really trying to understand and try to provide them as best comfort as possible. Being in a situation like that, you're at the emergency room, it's, not the most pleasant situation. So that really helped me in terms of my future career growth, in terms of bedside manner, just understanding people where they're at, understanding that their certain situation is not necessarily caused by circumstances of their own. They may have done everything right and are still ending up in situations like this. So this really kind of opened up my eyes, and really allowed me to put some emphasis on really understanding people's backgrounds, where they come from, what led them to make those decisions. And I think that has not only helped me in my practice as an EMT, working in the healthcare field, but also in tackling public health issues around this.
Underlying theme that like just I want to raise up, I think, is the interpersonal skills that you gain when you're in a
Yeah.
situation where you have to
Mhm.
talk with people and like relate to them when they're in tough situations, and being able to empathize and just show up in a caring way is something that we don't get taught enough. So I appreciate you sharing that. So going from volunteering in high school to getting to volunteer with the EMT service, you've done a lot of work as an EMT, as we'll get into when we talk a little bit more about your career. How does that play an important role in the work that you do now or in public health, generally speaking?
Yeah, most definitely. And thanks for the opportunity to kind of give this whole picture. Because, yeah, I would say I don't necessarily have traditional route per se. I was always interested in medicine, but honestly, public health was not on my radar whatsoever. I really didn't even have a second thought on like what I'm doing in this previous roles was public health. But yeah, so once I graduated high school, I could obviously no longer volunteer at the local hospital. So I was looking for opportunities over the summer prior to going down to school at George Washington University. I became aware that they have a teaching hospital there. They have medical school there. So I was like, oh, this is great. Maybe I can continue volunteering in that emergency room, or maybe a local facility around the DC area. Um, as I was going deeper into my research, I actually saw that GW offers a whole minor around emergency health services, so EHS. So this is a minor anyone can take. You don't have to necessarily be on a bio track, a public health track, anything like that. Anyone can take it. The first two courses in that emergency health services minor was to obtain your EMT license, or rather, it was to attend a EMT certification course. You have the opportunity, once you made it through the course, were able to pass all the test, both physical as well as written, you had the opportunity to gain your National Registry in Emergency Medical Technician license, or NREMT as it's known. They have a similar one for paramedics. So I finished that class. It's a 1 semester long class, the fall of my freshman year. So that really kind of opened the door for anything moving forward in my collegiate career when it comes to emergency services. Once I obtained my EMT license, really the world was my gambit. Either, George Washington, they run a volunteer collegiate emergency medical service. It's very similar to ones in your local area that run through the fire EMS. However, this one was all volunteer and all comp students. So not only do we serve the greater GW campus, both of the campuses, and Boggy-Bonnet as well as Georgetown, but also the greater DC area. So anytime DC fire and EMS needed assistance, or they tied up with other incidents, we have the opportunity to go off campus and assist with whatever medical or other operational needs that DC needed. So that was a really, really awesome opportunity. One, to practice my medical skills, both in a collegiate setting as working with a level 1 trauma center right in the heart of the nation's capital, as well as to just being a part of an organization like that not only surrounding yourself with similar people with different passions, different kind of backgrounds, but all kind of the same passion to help people to perform good pre-hospital care, and as well as just assisting the greater community. But really through that opportunity, it kind of, whether I liked it or not, whether you're introvert and extrovert, you really had to practice speaking with people, your line of questioning. You need to know how to ask the right questions in those circumstances to really fully understand the situation that they're currently in, and be able to make those judgment calls and what help you might be able to provide them, or what hospital center is best appropriate for them. So I think not only from like the clinical, operational, logistics, just experiences that being a part of an EMS agency as well as a pre-hospital care system really helped me with. It also helped me with just being culturally competent, understanding the community a little bit better, being able to go into a stressful situation and first make sure that it's safe, then secondly, make sure that people are comfortable around me in order to have a conversation, at which point then it's, kind of me leading the conversation. So I think that really helped in terms of my current work with public health and understanding where communities are coming from, but also making sure that they feel that they have a voice at the table, that we're considering their needs, their response, and as well as following up with them. So I think absolutely any type of clinical experience that you can get, whether it's volunteering, whether it's becoming an EMT and working in a service, or just going to your local doctor's office and just like sitting in one day, I think that's super, super helpful, not only from a academic perspective, but also, like you said, interpersonal, working with people. I think it's absolutely helpful.
Thank you for sharing that. And I really enjoyed hearing about that, and just highlighting how you can bring skill sets and you learn things. And one of the things I really liked about your story is that you decided that this was something that you wanted to pursue and learn about. And from that, you were able to get a certificate and build tangible experience and skills that you can literally talk to. Like, if you wanted to go to nursing school, this would have been applicable. If you wanted to go into your master's,
100%.
command, it would be applicable. If you want to go to med school, it would be applicable. It's just like so many ways that you can apply this as a tangible skill into getting to that next step of your career. And like, I just wanted to hear if there were any like one story or anything from your experiences at EMT that kind of stood out in a significant way to you.
Yeah, most definitely. And before I kind of jump into that, in terms of story time, I absolutely 100% agree with you. When I went into my undergraduate career, the environment in Washington D.C. in GW, it was very much, get an internship, have a fellowship somewhere, have a secondary side hustle gig, etc. So, for better or for worse, that made me feel that I needed to do something above and beyond. I'm naturally have that inclination, so it kind of worked well with me. But even if you didn't have that, just being in that environment really helped me. So, exactly that, I figured, okay, I'm interested in medicine. I'm interested in emergency medicine, maybe, going into the clinical realm down the line. What can I do right now as a freshman, as someone in high school that can set me up for success, but also open up several doors, not just one door, but several doors in which I have an option to do so. And if I don't necessarily want to follow it, then I have either other options or I don't have to do it necessarily. So, like you said, once I got that certification, not only are then building leadership skills, building community-based skills, interpersonal skills. I'm also building a network. So not only was I working with my local agency, but I was also coordinating with other university agencies around the district. I was also working with DC Fire EMS, and through that opportunity and through that certification, I also spent my summers in DC while I was not in classes, working for DC based EMS agencies. So not only did I was able to volunteer on the campus, I actually got the opportunity to be paid to work as an EMT throughout the entire city, and that experience really opened up my eyes. Because if anyone knows DC or any other major metropolitan city, there's definitely certain places that are nicer and certain places that the city just kind of forgets about. And that experience of working um, kind of leads me into my story time. I really think my best experiences through EMS was not on campus, not dealing with 18 to 24-year-old, typically healthy kids that are otherwise, just getting intoxicated on the weekends or maybe, um, forgot to take their medications. Not to say anything was wrong with that or they weren't experiencing any real medical emergencies, because they were. However, the patient demographic was very limited and typically healthy. So being able to not only volunteer work on GW's campus with uh, the university EMS agency, but being able to also be paid summer wise and work throughout the greater DMV area really opened up my eyes, not only to um, being able to do different medical procedures that I typically wouldn't be able to do in a campus setting, but also really seeing how people live, work, play in their natural habitats, in their neighborhoods, etc. And going back to my previous point about talking about really meeting people where they're at and understanding where they're at, many times on throughout those summers that I worked as an EMT in the greater city, um, I was called to areas that you could clearly see were underserved, had been forgotten about by the city, don't necessarily have any resources to both medical facilities, healthy foods, etc. And one day I got a call to a trigger, by the way, but a domestic violence call down in Southwest DC. And it was between a husband and a wife, and their son was there. And so I actually got the whole family back into the ambulance. I was trying to calm down the father, who ultimately got pepper sprayed. And so he was super irate. The DC Metro Police actually really did not want to come with me at all in the ambulance, even though that's typical procedure. So it was just myself in the back and my partner in the front driving us to the local hospital. About halfway through that call, I was, really having a difficult time calming down the patient, trying to treat him. If anyone has ever unfortunately experienced pepper spray in your eyes, it keeps burning, and you can't add water or anything like that. It makes it worse. So obviously, this patient was in an immense amount of stress and just pain. But at the same time, his wife and child were sitting right there. He was really agitated, kind of like pushing me off and like not allowing me to help. So I actually requested that my partner pull over on the side of the highway and just kind of re-coordinate myself, make sure that I'm doing the best possible care for this patient. So um, during that situation, once we pulled over, I asked the father, I was like, "Look, I'm here to help you, like 100%, but your actions are not only not allowing me to help, but you're also scaring like your family. And I just want you to be aware that like I cannot do my job if you were, carrying about like this way. And at which point, like the father actually stopped. He apologized to his wife and to his child. I allowed the child to like kind of sit with me in his chair while I was helping out his dad as we continued on our way to the hospital. So all this to say is that when you see someone in the hospital, or when you see someone at your research clinic, or when you're conducting surveys out in the field, you're only seeing one snippet of their reality. I have no clue what happened prior to that, me showing up on scene that led, to pepper spray being deployed, etc. But I could tell basically piecing up the environment, the situation, how they were talking to other people. I'm painting myself a mental picture, and I'm very quickly not only assessing the situation, both from a medical standpoint and an operational standpoint, but also like how can I give the best story to the hospital staff once I draws them off, because that's only their medical issues are only one standpoint of that. And that's time and time again, I saw that. And that's what kind of led me to public health, is that we're only addressing the immediate health concern. We're only addressing what is going on right here and right now. 9 times out of 10, patients don't have the ability once they're discharged from the hospital to follow up on medical care, to have access to the prescribed medications or routines or exercise that they have. And I can tell, like, so even though I was immediately helping this individual and their family going to the hospital, I don't know like what happened to them afterwards. I don't know once I dropped them through the emergency room doors. And the same kind of premise happens throughout public health. We come into a community, we go through interventions, we think we understand the community, do an intervention, we see that impact, and then we leave. And what is the sustainability behind that? What is that one time off, funding to access this medical resource or this tool, etc. So not only again, like, oh, I have a million of those similar stories, but it really opened up my eyes to, I was doing all pre-hospital care. So what about all the other portions of it during the hospital care, after the hospital care, and what are we doing to prevent these issues? Whether it's domestic violence, whether it's infectious disease, whether it's chronic illnesses. Why are we just slapping the band-aid on that issue and just like sending that wound back out into the environment is what really spurred my interest and kind of what led me from going from emergency medical services, pre-hospital care to public health. I really wanted to go from slapping the band-aid onto it to preventing that wound.
I like that story, and I think it is important in just highlighting how a path can come to public health, like thinking that you're doing the EMT work, you're learning about the skill sets, and in doing that work, you're learning more about the dynamics of the community, and that while the system is helping people, it is not helping the root causes of many of their issues, but helping them in a point of crisis, which is important, of course. But it also it begs the question, like, what's being done when I'm not here? What are the community aspects that are affecting, or the social aspects that are affecting these people, and what can we do on a population level to ensure that these things aren't happening at the rates that they're happening? So definitely love that story, and I know we'll get a little bit more into it. And before we get into how you began your collegiate career, what does public health mean to you?
Yeah, no, totally great question. And like I said before, honestly, before when I was even in my collegiate career, I didn't second think on what public health was. I think I'd start to come across from it while I was, doing my rounds of EMS, while I was taking some of my pre med courses, biology, chemistry, etc. I kind of tangentially heard of it. Oh, hey, look at this new program that they started up. This sounds interesting. Lo and behold, freshman between that when I was a freshman till now, many years later, I think what public health means to me has really evolved. However, I think the real basis of it kind of boils down to, and I think a lot of other people would say similarly, is promoting and protecting community health, but also ensuring that the system is working in favor of the end user. And then in this case, the end user is the citizens, is the people of your community, the people that you surround yourself with, that you see at your local restaurant. How not only is public health ensuring that we have safe, equitable access to preventative services, but also how are we making sure that the system is not set up for failure, is not set up to disadvantage um, one group over another. And the time and time after again is we're seeing that. So really, to me, what public health means is breaking down those systematic barriers to promoting and protecting the community health. I think we have all of these high level, like, key trigger words that public health likes to throw around, likes to say that we're addressing, that we're doing. Really, if we're not first starting by looking at ourselves and the system that we've set up in order to ensure and promote this health, then how can we do better for the community, and how can we do better for ourselves? So I guess kind of a long-winded answer to say, like, again, like, promoting and protecting the community, but at the same time ensuring that the systems that we're using to protect those people are actually working in their favor.
And before you knew the word for public health, you decided to pursue a Bachelor's of Science in Kinesiology and Exercise Science at the George Washington University with a minor in Emergency Health Services. Going into undergrad, what was your thought process?
Yeah, 100%. And again, like, I think I have a more atypical route to public health than I've seen. But what kind of led me was I was really interested in going to physician assistant school, PA school, after my graduate degree. Through my EMS experiences, I kind of figured I was really interested in working in the clinical setting, whether it's a hospital or a local family clinic in the emergency medicine space. I thought that was really interesting. I thought day to day would really keep me on my toes, and I would ever be learning. So instead of doing the typical pre med, pre bio track that most people do, I figured let me kind of differentiate myself a little bit, but not too much, while still also making sure that I can achieve those pre med, pre PA courses. So that's what kind of led me to exercise science. I realized once I got into exercise science, that program is actually housed in GW's Milken School of Public Health. So even though I wasn't studying public health as an undergrad, I was still surrounded by that. I was still taking courses that had some public health foundations background as well. So that was my first instance of really getting into public health. However, I was really interested in anatomy and physiology. It's very similar to a lot of concepts that are already covered in EMT school. So kind of really excelled with that. Again, the exercise science undergraduate degree also allowed me the flexibility to take that minor in emergency health services, where was able to take additional classes around, like, tactical medicine, operational aspects of emergency health services, etc. So one, really just trying to differentiate myself from the rest, to having the ability, once I graduate, to I could go the exercise route, I could go the doctor of physical therapy route if I indeed did not want to go to PA school or go elsewhere. So again, kind of similar tones with my high school EMT experience. I really wanted to set myself up with the opportunity for not one door to open, but multiple doors.
And how did you build this mindset at such a young age?
I think it just kind of came out from my experiences growing up as a first generation American here. I knew, first and foremost, I don't have that familial history or that background in America that I could leverage existing networks or existing partnerships from either my parents or others that were around. Um, I was really set on the path of focusing on my education and also making a name for myself here. So I figured one of the best ways to tackle that is to kind of, like, imagine an octopus having, like, your tentacles in a couple of different things. I didn't beat myself up about being perfect in all of those aspects, but I really felt that if at least I put myself out there, experience new things, and try things, at minimum, I would understand what I didn't like. And that would kind of narrow down the field of what I pursue. So I think from a young age, my parents not only instilled, academic success, as well as really valuing your education that you can take it from, but also not turning down any and all opportunities. So that really kind of framed my mindset. Is like, hey, this might not sound totally what I'm into, but hey, I wouldn't know unless I tried, right? So
Love it, and I hope that other people could also work to cultivate that type of mindset. I think from a young age, because it's not something that is that natural for someone. I think that's young to be like so intentional in choosing and thinking through these things, especially like the unconventional route to med school or to whatever path afterwards.
Mhm.
I think that is probably becoming more of a norm, and I think even so in public health, it's like you don't need a public health bachelor's to go to get your MPH. And I think the ability to be varied and have those experiences just brings more richness to if that's public health or whatever other work that you're doing. So it's just like all about building on the experiences. So love that.
100%. And if I could just add, Amari, too, it may have came a little bit easier to me than others. However, that fear factor, that factor of potential failure was always there, and I think will always be there for anyone, whether they're tackling applying to school or applying to a new job or doing a million things at once. There's always kind of that fear of failure, that feel a fear of not knowing, and I think one having that mentality of being open to opportunities is key, but then secondly also not not being super hard on yourself. If you get rejected, if you don't have the outcome that you originally intended to be, don't give up. Don't this kind of goes back to as well as public health themes as well. If your intervention doesn't work once, doesn't mean that the whole process is flawed or something is wrong. That you're wrong as well. So I think that's also super important to remind listeners to is that be open to opportunities, but also be open to failure.
Absolutely.
Yeah,
Failure and those are just redirection and learning points to move forward in your journey.
of course.
While challenging, they are part of the process, and it's something that the more no's you get, the more comfortable you are just reaching
Mhm.
out
Yep,
and getting to
exactly.
know. And yeah, and I always say it's like if you get a no from someone, you're in the exact same position you were right before they told you no. So like the upside is
Mhm.
so high, but the downside is like nothing happens. Maybe a little bit of your ego gets crushed, but you know that's part of life, unfortunately or fortunately.
Something I learned in, or I took away from my exercise science degree was muscle memory. And I think the same
Mm,
premise occurs here, whether it's applying to a million jobs. After two, three, four, you get the nervousness out, and then it becomes mundane. It becomes, you don't have to think about it. The same way in receiving rejection, in receiving feedback, all of those soft skills that are really valued in public health. I personally think you can only be successful if you just keep doing it. If you make muscle memory of it, and the same thing with like a fear of rejection too. After your rejection, you're not going to care as much as probably like your first one. So I think that's also a really helpful like kind of tidbit in how to frame things.
yeah, love it, love it. And then while you were in your bachelor's program, I know you spoke a little bit about some of the experiences while we were talking about the EMT, but I will list out the experiences, and you have quite a few experiences during your undergrad program, and then you can walk us through maybe the ones that are most pivotal to you,
Sure.
or maybe ones that you haven't spoken on as yet. So the positions that you had during undergrad were research assistant for the neuroscience lab at the Children's National Health System. You were emergency medical technician at the American Medical Response South Country Ambulance and Emergency Medical Response Group. You were a telecommunications specialist and EMT at George Washington Medical Faculty Associates, Department of Emergency Medicine. You were the vice president of campus operations, and you were the preparedness division intern at the DC Homeland Security and Emergency Management Agency at DC government.
Yeah, I think our audience is kind of catching on to the theme of this podcast, maybe in terms of diversity of experience. I'm again really, really all about that. I also just took opportunities that came my way that I heard back from that I thought were interesting, but Yeah, like you mentioned, just to kind of highlight some of the key pivotal ones I think were really influential, not only in my public health career, but just as a professional in general. Yeah, so let's kick off things with talking about the research assistant position at Children's National Hospital. First and foremost, this was a research based position working with several postdoctoral fellows at the hospital system. So that was one of my first real experiences in really going into a very highly research based setting in which everything was very methodical, very well planned out. I was specifically working on investigating the effects of certain substances such as alcohol, drugs, etc., on development of fetal brains. So how would this impact the baby in the mom's womb, for example? In this case, we were working on mice. So what I really gained from that was research methodology, critical thinking, as well as attention to detail, which not only in the public health, the medical field, etc., but anywhere these skills are required. Secondly, my time at the George Washington Medical Faculty Associates, specifically their Department of Emergency Medicine. I was serving as an EMT as well as a telecommunications specialist. So not only was I working as an EMT, so I had that clinical background, but I was working in telecommunications. So um, how can we leverage medicine in remote areas around the world? So in that case, our clients were mariners on ships in the middle of the Pacific, or a team down in Antarctica, or a U.S. embassy in a war zone. So we were providing emergent services to people that did not have a hospital, did not were not in the United States, were not anywhere near that. So not only did that allow me to better hone my clinical skills and how I conducted myself as an EMT, but secondly, it taught me a secondary skill, which was how to leverage communications devices such as video conference, video chat, other means of communication in order to still provide emergent medical services. On top of all the logistical aspects that it takes to make sure a person receives accurate medical care. So if you're on a ship in the middle of the Pacific, then we need to find you the closest port, the closest facility that can treat you and treat you properly. And in some cases, we actually had to fly those patients back to the United States to receive additional care. So not only did I get again that clinical aspect, but all the logistics, all of the coordination and the communication behind that. So again, I think that was absolutely pivotal. And in the sense, from a public health standpoint, when you're working on a project, you'll have five, six, seven different stakeholders that are meeting on a regular basis, maybe not a regular basis. So how do you coordinate with them? How do you make sure that you're project log and that you're making actual valuable impact? So that position really, really helped me with that. And also, not to mention, those were all under really stressful situations in which, some people, they really needed immediate medical help. So doing things in a stressful situation and kind of coming over to public health, to other areas where it isn't as stressful, is also really helpful. You really kind of get a better sense of how to prioritize things, how to time manage things, which I think everyone struggles with that with from time to time. And then lastly, I want to mention my time with DC Homeland Security and Emergency Management. One summer, I came across the opportunity to serve at that agency. They have a very robust internship program. So I applied to the Preparedness division, where I was successfully accepted into the program. I was super excited. I really didn't I knew preparedness from an EMS standpoint and how we can prepare for mass casualty events, large scale events. We did them all the time. They're always hosting presidential inaugurations, marathons, conventions, etc. So I had that preparedness experience, but I didn't understand preparedness from the viewpoint of police, of emergency management, of our federal partners, like the FBI in the case down there. So this internship in the preparedness division not only gave me a better understanding of how emergency management comes into play, taught me why emergency management is valuable, but also I got the opportunity to host a agency-wide tabletop exercise. In that case, it was kind of develop your own. So we developed a bioterrorism scenario for Washington D.C. But that really, again, that scenario and that experience opened up my mind that there's a million and one things that are going on um, in your community that you're not necessarily aware of, that or that there are plans for, that they have response plans that every individual agency from your Department of Transportation all the way to fire and EMS are ready to go and respond. So that was super, super interesting. At the same time, I was also tasked with the opportunity to develop a professional development kind of seminar, webinar, like week long training for the agency. So as an intern, I kind of I found a bit of irony in that and me setting it up for these professionals, but at the same time, it kind of showed me that like, hey, the skills that I think are valuable now are the same skills that they're looking to train people on. That these same soft skills that public health really emphasizes on potentially might be more important and might get you that job, might help you win that grant more so than these kind of like check the box hard technical skills. Really, they require put it on your resume, put it on a job description, etc. So, yeah, that's kind of a rundown of my undergraduate experience. As you can see, there's no kind of trajectory, rhyme, or reason beyond just being in the preparedness disaster space. But I really wanted to again put out um, those feelers, those experiences, and really get a well-rounded understanding and perspective of everything before I kind of like funneled myself into a specific direction or anything like
That's a wealth of knowledge and experience that you're able to get throughout your undergrad. And I think like to your point of, really wanted to understand what I want to do. The best way to do that is by doing as much as you can and really figuring out, okay, what do I like and what don't I like? And then pursuing the things that you do like. And you've learned like so much from like the telecommunications specialist and
that.
doing EMT. I can imagine just like learning how that has been beneficial to like your communication skills and just being able to like put in tell people information in a succinct way that
Mhm.
is really going to help them to operationalize it. And I think to your point of the soft skills, that those things that mightn't show up necessarily on a job description, but when we think about when you're becoming a good candidate for whatever position it might be, and you're matching with someone and all those hard skills, it really is those experiences where you develop those soft skills and you can like speak to those or like just act in a certain way, whether that's in the interview or through your cover
Mhm.
letter, to just show them that while you have all the hard skills that they want, you also have these things that would be valuable for them as an organization and you showing up in the work, which I think is awesome for you to mention.
Most definitely. And I want to emphasize the fact that in all of these positions, it's even though, you're providing medical services, you're providing X, Y, and Z, sometimes, and even in public health, we forget about the human behind it. So just like we're providing to a customer or your local community, it's the same thing behind behind me as me being that EMT, me being that provider, etc. It's all of my lived experiences and all of my past, um, experiences that I was able to do that also influence me and influence how I'm going to react, provide, be able to help you. So I think it's absolutely.
Were there any undergrad takeaways that you wanted to share? Yeah.
Yeah, thanks, Amari. So, in terms of and key takeaways from my undergraduate experience, I would say first and foremost is you may not know exactly what you want to do, but going into your undergraduate experience with the mentality of trying to become the best, well-rounded individual professional that you can be, I think is invaluable. And what I mean by that is opening up yourself, whether it's from in an experience standpoint in getting those internships or those fellowships or shadowing someone to also having diversity of thought in the sense that everyone's going to have areas that they feel that they're strong suited in for me, it was anatomy and physiology, etc. But also being open to putting yourself in situations that put yourself out of your comfort zone. So, for me, I didn't really know emergency management. I didn't really know preparedness. However, I went ahead and applied to it, not expecting anything back. And fortunately, I was able to go into that opportunity, and I went into that opportunity with an open mindset. At which point, I learned a ton, but also constantly was like, okay, how can I apply this to my current passions? How can I expand this? How can I make this better? So I think that would be my biggest takeaway is really just trying to gather all those experiences. I also want to say is value your time. Not everyone can do multiple experiences, or maybe you can do multiple experiences. However, your time is valuable, you are valuable, and what you contribute is valuable. So, first and foremost, especially in the public health and pre-medical fields, a lot of times these experiences are not paid. So first and foremost, all of your time should be paid. Don't necessarily just, labor is not not free, and especially not. We need it in public health, so don't burn yourself out too quickly, but also like don't undervalue yourself, because once you start doing that from an early onset, then you won't be your biggest advocate. You will have difficulties asking for that raise or leveraging something. So I just want to highlight that experiences and diversity of experiences and diversity of thought is super important, but at the same time, make sure that you know how you can leverage yourself for the best experience and that you're not underselling yourself.
100% agree with that. You then pursued your Master of Public Health in Environmental and Occupational Health at the George Washington University. Tell us more about that thought process.
Yeah, most definitely. So that was right around pre-COVID. I just graduated with my undergrad in exercise science and a minor in emergency health services. I was like, okay, well, what's next? And I started looking around for exercise science jobs. And what I quickly learned was that if you did not have your doctorate in physical therapy, it was pretty difficult to find a job. You would have to go back to a PT school to be a physical therapy assistant, which actually would take, I think, around 1 to 2 years extra just to have that certification before you can start working. So I was like, I don't think that is super necessary. I also don't think that I want to go the physical therapy doctor route. So at which point I was like, okay, I think I still want to pursue that route of going to PA school, concentrating in emergency medicine. So before I apply to that, let me do a master's or do an experience that I think would help bolster my application. As many of our audience members have probably seen, like whether it's pre-med or pre-nursing or pre-PA, etc., these classes have certain criteria, being 26, 27, median age, having, 3 to 5 years work experience, etc. So kind of in that same tone, I was like, I have all these wonderful experiences, but let me do something else to bolster my application in that sense. So I looked at back at George Washington, back at the school that I was in, Milken School of Public Health, and I saw that they had a Master's of Public Health in Environmental and Occupational Health. Specifically, I didn't realize that there was fields in public health that addressed disaster preparedness, that addressed climate change, that also looked at occupational health from a first responder standpoint and otherwise. So that really kind of spurred my interest. So what I did was my last semester of undergrad, I actually went in and talked to the advisors and the chairs for that department to really make sure that it was a good fit. At which point I applied and, obviously was successful in being accepted into the program. But that really that was the starting point right there. That once I started my MPH and really dived into all those environmental classes, my mind opened up into, whoa, I've been doing a lot of um, I've been doing a lot of response work in terms of responding to people during their incidents, during their situations, etc. During my previous experiences as an EMT, as a telecommunications specialist, as a preparedness division intern. However, There's another field that's also addressing this, but from a prevention standpoint, from a mitigation and adaptation standpoint, that's what really kind of opened up my world. I was like, well, like, we can address climate change, disaster preparedness, not from an EMS clinical healthcare setting, but from a preventative standpoint. So that's what really kind of spurred my interest in both public health and then specifically in environmental and occupational health. Yeah.
I love that. Love that. I like the thought process of, well, the theme of the story kind of going like from EMS, EMT work, realizing that there's preparedness work there, but then there's also preparedness work on a population prevention type of scale and level, and then in that diving more into public health as well as leading that this work is also intersecting with the environmental work, the climate work that's going on. And while you were doing your MPH, you were Environmental Health and Safety Fellow at IPC, Association Connecting Electronic Industries. Tell us about that experience.
Yeah, definitely. So I was fortunate enough to actually a former DRPH student of the Milken School of Public Health at GW came into the director role at IPC, which is essentially just an electronics trade association. They represent hundreds of different, electronics companies around the world. Some of them definitely heard of before. So she came into the director role and was looking to host practicum opportunities for MPH students on environmental health and safety. So she, kind of put this listing in our GW listserv, at which point I reached out, applied, was fortunate to be selected on that. And that was kind of my first experience working both in a toxicology setting, but also working actually with governmental agencies. In this case, it was the EPA. So we had spent time on doing some research and writing a white paper on the impacts of TBPA, which is a chemical that is typically found in, let's say, your furniture, all of your furniture, your couch, your dining room cushion, etc. This chemical is used for fire prevention. However, the EPA was looking into this chemical because they were trying to see its safety, its potentiality of causing cancer, etc. So, from our standpoint, that was a really interesting experience because not only are we trying to ensure that we're protecting humans from this chemical, if indeed that it is of risk, at the same time as juggling the balances of our members in this association, in that case, the electronics industry. So the electronics industry also uses TBPA in all of the circuit boards that are in your phone and your laptops, the same fire suppression system. It's on the board. So in this case, EPA was looking for comments from the association, from its members on the safety factor. Does TBPA leak out of your circuit boards, etc.? So that was a bit of advocacy, a bit of research, a bit of writing. So this experience, all in all, really was my first kind of deep dive into the practical applications of how public health principles are applied, also applied in a corporate setting. Typically, we think about it in the governmental, direct to community, but this is also public health being done at the corporate level. So that was really, really interesting, eye opening experience for me. Also taught me that I enjoy toxicology. I really find it interesting. However, I don't see that as a future career path for me, just in particular. Shout out to all the toxicologists out there. However, it's a very important field, but doing that and experiencing that also taught me that I don't necessarily want to be in that side of environmental public health. So that was also really beneficial from that experience.
Those are the important things, like learning, like you can enjoy something, but you could also enjoy something not in the sense that this is going to be work that I'm like doing for the rest of my life, but so there's balance. And then you also had an internship at the National Network of Public Health Institutes. So tell us about that experience.
Yeah, so similar to that previous one, IPC, a former Milken School of Public Health master student. reached out and was looking to hire a intern at the National Network of Public Health Institutes to work on a hurricane response or recovery project. So, ding, ding, ding! When I heard that one, that really was like, whoa, like, okay, that's super awesome. That again, I didn't know public health could address disasters, especially disasters caused by climate change, in this manner. So that was my first foray into the national public health nonprofit space. So, you can kind of think of an MPHI as very similar to NACHO, ASTO, FAB, CDC Foundation, etc. So that was a great opportunity, one, to get my feet wet into public health, also really kind of hone in my skills. While I was finishing up my master's and really making sure that I was ready to like jump into the workforce. Fortunate enough, based on the work that I was doing in this internship, it just seemed like a good fit, and I was actually able to transfer that position from an internship into a full time position right around the time I was graduating from my MPH. So, um, what that taught me too was like these experiences, these fellowships, these internships. If you give it your all and you do good work, you know, if the organization is able to and willing to, then they will help you and work in your favor as well. So, um, ever since like my undergrad experience, that was kind of my guiding thing was like, hey, like if I get this internship or this fellowship, potentially could convert this into a job later down the line, or at least have that create that network. So in this case, it kind of worked out for me, and that's kind of what led me here today, where I'm currently working at.
Yeah, love that, and that is a path that is like I've heard that similar story when I was in my master's of public health program from the students that were above us and the alumni. Is that most of the times, if you have an internship, and as you said, like if they are able to, it's an easy transition for them to just bring you on into that position, and there you already have like organizational knowledge and just institutional knowledge
Of
that
course.
just helps you become more successful in that position. But in thinking back to this, I know you said like do good work. Is there any other advice that you'd give to someone that is in an internship with maybe the potential to get hired on into a full-time position? How would you advise them to show up throughout that internship?
Yeah, most definitely. And don't go into any opportunity, whether it's an internship, whether it's a volunteering thing, like looking for like the end result, looking for that end game, you won't be successful. However, I think in terms of advice for going into internships is go in having a plan. What are you looking to gain out of this, whether it's skills, whether it's creating a network, whether it's a tangible deliverable, and then so note that down like at the beginning of your internship, like these are my three main objectives, this is how I'm going to develop throughout my time, and then hold yourself accountable to it, hold your supervisor, your trainee, etc., accountable to it. At the same time, inquire with your internship, with your organization, with your fellowship, what do they want you to get out of this, and what do they need out of this? So it's kind of it's a mutual give and take. So first and foremost, like I mentioned, probably I wouldn't suggest anyone in the public health or similar fields taking internship fellowships that are not paid. So this is one way again to hold even that paid or unpaid, if you do take it, accountable, so that it's working for you. So having that development plan, making sure that so by the time your internship ends in 3 months, that you developed XY skills, that you met five new people, etc. I think really going in with intentionality, whether or not you are able to convert that into a full-time position, at least will allow you to maximize or potentially maximize the experience for you.
And throughout your master's of public health program, as well as the experiences that you've had, you've done a lot of work around the intersection of like public health and climate change. Can you talk a little bit about the importance of highlighting that?
Yeah, most definitely. I think this is kind of where this podcast is recording, or this session rather, kind of comes full circle here. So as you've seen, we kind of painted the picture through Obari's descriptions of, me starting back way in high school with EMS, with going through undergrad and doing all those related but not so related experiences, and then finally going back to school and obtaining my master's in public health. I think what I've learned over time is that these very separate, distinct fields that are treated as such, that are funded as such, that are organized as such, are very, very, very much interconnected, overlapping. There has to be duplication going on. So, in terms of the intersection between climate change, public health, and emergency services, first and foremost, I don't have to tell anyone here listening about the implications of climate change, specifically on human health as well as mental health. You turn on the news, it's every other day now that there is a massive hurricane or intense flooding or this or that, not only in the United States, but all around the world. So, um, first and foremost, climate change is here. As we all know, it's also impacting people every single day. Whether or not you see it, whether or not you feel it, it is impacting your local community. Uh, Secondly, what I saw from emergency services, emergency medical services, fire, EMS, they're response focused. So they're responding to these disasters. They are making sure that folks are safe in a time of crisis, etc. However, there is vast opportunities for emergency services to also support from a preparedness standpoint, from a recovery standpoint, in the case that if your local fire and EMS department was able to host, preparedness events on like, hey, hurricane season is coming up. You know, make sure that you have your emergency go kit. Make sure that you have a shelter identified. Make sure that your family members know where to find you, etc. If they could shift their focus not only from response but to prevention as well as recovery, I think the intersection between what they do and what public health is already doing, again, with preparedness and recovery around disasters, would only um, would only make the intersection even more clear. So, what I'm trying to say is that I think public health is already doing a lot of great things in the disaster preparedness space, the climate change space, the same thing that emergency services are trying to do from a adaptation and mitigation standpoint, as well as what we're doing in our typical environmental health, trying to mitigate, those infectious diseases from transferring, whether it's from animals or whether it's from, our local water systems. We're all working on different aspects of the same exact issue. And what kind of makes me want to pull my hair out is it's like we know in the industry, we know in public health, like communicate, collaborate, bridge gaps in sectors. But again, those are all like great words. If you're not really like going into it and making sure that your fire and EMS, your healthcare, your emergency room doctors, your environmental workers in your public health department are not all at the table and like you're all coordinating together. That's what I think really, really needs to happen in order to avoid duplication of services, in order to advance all of our work that we're doing in public health, emergency services, healthcare, etc. And really just making sure, like I said back when you had asked, what does public health mean for me, is ensuring that the system is working in favor of its end users, and obviously in this case it's our citizens. So how is emergency services, how is public health, how is environmental health, as individual systems working to working in the favor of the end user? They're not working in the favor of the end user if they're all tackling um, one issue, in this case disasters or climate change, from that standpoint, this standpoint, XYZ standpoint, or I in public health believe this is the best way to tackle this issue. Like, no, like there are a million different ways to lead to one outcome, right? So why can't we have all three of them uh come to the table and work together? And that's what I mean. That's when you ask me about intersection, that's what I think about. Like in my mind, I see these three separate, or treated as separately, entities and systems, as they literally need to intersect for the literal term of the word. So
Yes, that's real. That's real. Because I think without the intersection and really like supporting all of those, then we get like siloed solutions and not really like holistic solutions, sustainable solutions, solutions that are really going to impact change for a long run. And we all know, like as you say, like collaboration is a buzzword in public health, but like when we actively and effectively collaborate, it results in like meaningful change. So definitely hoping that more of that can come around as well. Um, and before we move on to the work that you currently do, did you have any takeaways from your MPH program you wanted to share with us?
Yeah, I think in terms of takeaways from my MPH program, kind of going back to what I said in terms of experiences is especially in your MPH program, which is typically treated as like, okay, like now you have like selected, like I do want to work in public health. I'm interested in this kind of field. I would spend more time exploring all aspects of public health, whether you're going into a master's of public health, where you're going to another master's, is taking the time out to explore all of the different areas under that industry, under that system, etc. And one, understanding how it intersects with your passion. For example, my passion is environmental health, disaster resiliency, etc. But how does maternal and child health play into environmental health? How does chronic illness play into environmental health? At a certain point, you can kind of see, you're going to build a web, and see all of these things are all interconnected or all related in some way, shape, or form. So I want the audience to take away that is like, even though you're focusing on one specific area, public health, or you have some interest, everything is interconnected, and you would be doing yourself a disservice by not, at, at minimum, connecting those points. And then back to my experience with IPC and the Electronics Trade Association was, be open to opportunities, because sometimes, even though it may not be super exciting, they may not pay you, they may XYZ, it did give me valuable skills at the same time, showing me like, yes, indeed, I don't necessarily want to do this. And that down the line saves you a lot of time. Imagine that all you're doing is applying to jobs, and take the first job that comes your way. Who knows, like you might not enjoy that position, you might like 5 6 weeks down the line, you might hate it. So I feel like this also kind of saves you some additional time, especially when you're like, in your MPH, your time is more, valuable, limited, other life priorities, etc. You want to at least have, like, that's another way that you can at least give yourself some assurance that you indeed at least like this or don't like this.
And you shared that you transitioned from an internship into a full time position as the Climate and Crisis Preparedness Senior Program Associate at the National Network of Public Health Institutes. Tell us more about what you do in the
Yeah,
role.
most definitely. So, yeah, so as currently I'm serving as a senior program associate in the climate and crisis preparedness portfolio. So essentially, I basically kind of do the life cycle of grant funded work, from identifying grant opportunities to writing for that grant to, submitting, hopefully winning that grant. Once we've won it, I assist with program administration, program setup. So whether it's timeline, deliverables, outcomes, budget, resources, as well as staff allocations. And then once the project's kicked off, working directly with our funding agency, which typically is either CDC, AmeriCorps, NIH, FDA, etc., typical, governmental funding agencies, to really support and make sure that we are meeting exactly the deliverables of that grant. Been super, super fulfilling kind of to see that whole process, from writing the grant to performing the activities of the project to closing out the project. So been super exciting. Specifically in the CC portfolio, I've had the opportunity of working on projects related to hurricanes, disaster surveillance and mortality tracking, um, coaching for enhanced disease surveillance services, public health leadership and data science, and most recently, I've spent the last year standing up a public health AmeriCorps program focused on addressing climate change and disaster resiliency in communities around the country. So in this case, Hawaii, Puerto Rico, and Boston. So really been exciting. I think it's been also super helpful because not only is public health an industry, it's also business. So understanding that business behind it, like any other industry, is super important. Super important, and without having that basics, you can't do good public health.
So you're doing a lot of great work right now. I'd imagine shifting from an intern into this role, there were a lot of things you had to learn and grow into. What was the biggest learning curve that you had to get over, and how did you overcome
Yeah,
that?
yeah, most definitely. I think the biggest learning curve was going from that academic mindset of meeting deliverables to going to that professional mindset of creating deliverables. In the sense that when you're in academia, you try to get by week to week, test by test, semester by semester. However, in your professional world, like you were being paid for your thought leadership, for your knowledge, for your skill set, for your perspective on tackling that issue, tackling that deliverable, etc. So for me, it took a bit of time in stopping what I'm doing, like reading what I'm writing, like what am I doing this for? Am I just doing it to prove a point here in typically in academia or in public health in professional settings? Am I looking to solve a problem? Am I looking to give a solution to a community or improve outcomes or make an impact, etc.? So I think that kind of mentality took me a little bit of time to kind of shift over, but once I realized that, and also stopped and was like, wait, be confident in your suggestions and like your understanding of this. I found myself not having as much trouble in terms of writing up potential project plans or how are we going to measure this impact or does this actually make sense for what we're looking for the project deliverables.
Yeah, thank you for sharing that. And what do you enjoy most in the work that you get to do?
I enjoy meeting people from all walks of life. Being a national nonprofit, I will be meeting both of my internal team, which they all work remotely, so they're in all parts of the country. But then also, as the National Network of Public Health Institutes, we're a membership association for all of the public health institutes around the country. So you name a state, there's a public health institute there. So always talking with individuals from different states, from different demographics, from different communities, and also trying to address their specific geographic or other public health related needs. And that specific locality is really interesting. It's really interesting to talk to someone in Florida and then talk to someone in Washington State versus Southern California to Maine. They're all having maybe similar public health challenges, issues, or tackling them, but the ways they're doing it, the resources they have access to, and like how they're going about it is super can be super different, can be super similar. So it's super cool to be at the table with people from all over the country and also having that diversity of perspective, being able to work with people and being having that flexibility and trying to meet people where they're at while also maximizing the work that you're doing has not only been challenging but super I think fruitful in terms of my professional.
And before we move on to the Furious Five, where can people connect with you, and where would you like to see yourself in the
Yeah.
future?
So most definitely, I believe you have it listed or will have it listed on here, but you feel free. Anyone can connect with me on LinkedIn, Ajay Persaud. Pretty easy. You can also just Google me. Always happy to connect. You can also just reach out. My emails on my LinkedIn. So anytime you want to chat about environmental, public health, EMS, emergency management, feel free to do so. In terms of where I want to see myself, I'm looking to kind of see opportunities where I can bridge the gap between EMS, healthcare, and emergency management and public health. Um, in my mind, bridge the gap is a trigger word, so for lack of a better term. But however, I really am looking for either to create a space or be in a space where I can tackle public health issues while also tackling the same issues in EMS and healthcare. I'm really interested in finding a space like that or creating a space in which we can tackle all these multifaceted, multi-industry issues at the same time through, one means of system, project, etc. So super excited to kind of see how that works plays out, especially as technology advances with AI and climate and how we use that. So yeah.
Well, that's awesome. We look forward to following your path and seeing where the journey takes you.
Most definitely.
And then moving on to the Furious Five, the 5 questions that I ask all guests. Number 1, what advice you to give to a student trying to pursue a career in public
Yeah,
health?
most definitely going back to previous stuff I said in the podcast. Act like an octopus. Have your tentacles in a number of experiences. I think it would be my biggest advice. Public health, whether you study it or whether you come into it by chance, is all about lived experiences. It's all about understanding the community, and so being able to have a number of experience, whether public health or not public health related, always think about those experiences and the soft skills that you can take away, aka interpersonal skills, communication skills, professional skills that will take you very far in whatever you do. So, yeah, definitely. Yeah, you can cut the last part out.
Number 2, if you're talking to someone wanting to get into your position, what advice would you give them?
So, good question. I mean, typical to very other similar public health positions. Kind of doing that minimum job requirements, aka having a undergraduate degree or a master's degree in public health, maybe specifically in environmental, occupational, or similar fields. However, beyond like kind of those typical checkbox things, I would also recommend people. Volunteering at your local fire and EMS agency, volunteering at your local hospital system, or doing a ride along with an EMS supervisor. I think having education is great, but also having hands on experience that you can speak to, that you can learn from, that you can think about after, that session is actually more valuable. And I also think, like in this line of work, when you're thinking about disaster preparedness and recovery, you have to put yourself in the mindset of the community. So it's better that if you're planning to do this type of work in a certain community, that you understand that community or have lived in it.
Number 3, what's something you're working on improving in your life right
Yeah,
now?
that's a great question. I think from a professional standpoint, looking on how I can do additional opportunities outside of public health, like what I'm interested in doing, such as like this podcast, for example, connecting with you, Amari, and bringing not only, my line of work, the small kind of environmental disaster preparedness ideas into the greater public health. I really want to bring One Health, which is the idea of addressing health in all policies, and to the table. And I think disaster and climate change needs this and should be considered like that. So I really want to explore avenues in which, like, I can be at these like type of tables, join advisory boards, be able to share. Share thoughts and potential solutions around how we can address these issues.
Number 4, professionally, do you recommend anything?
um,
Mhm.
Yeah, that's a great question, Omari. So professionally, I would recommend that no matter what area of public health you're in, or if you're clinical medicine or emergency services, etc., that you sign up for newsletters, that you sign up for, podcasts like similar to this one. Just being able to have different avenues of information and staying up to date with trends, technologies, changes in the field is absolutely critical. And no matter what field you're in, will help you kind of stay on top of things and have speaking points, be able to relate to people, etc. So any newsletter, like, from the CDC, other federal agencies, other, to other, professionals in the industry, etc.
And number 5, last but not least, if there was one piece of advice you'd give to your younger self, what would it be?
Great last question. I think for me, it would be, don't be so hard on myself with not knowing what's next in life. I think when I went when I graduated high school, I thought I was going to go to medical school, and that by this time I would be practicing in clinic, XYZ, etc. Obviously, it turned out much differently. But during that time period, I feel like I was like overly hard on myself. Like, hey, I didn't get that. I didn't meet that goal, or I didn't meet that internship or that opportunity or something like that. But in retrospect, like, I think just having that open mindset, being being comfortable with being uncomfortable, and just like having that positive mindset and that confident mindset to like push through in times of adversity while not putting yourself down is absolutely integral. Public health is not an easy field. Even once you get your MPH, once you get into the field and you're working, every day is a challenge. Every day is a challenge, whether it's feeling like you are doing enough for your end user or community to meeting the demands of a work of an industry that is continuously losing people every day. So just don't be hard on yourself. We're all doing great work. We're all here to do to help people. So
Absolutely. Well, thank you so much, Ajay, for coming on today and sharing your story and your insights. I really appreciate it, and I learned a
yeah,
lot
thank
as
you so
well.
much, Mari, for having me. It's been an absolute pleasure speaking with you today, and I hope the audience kind of has some takeaways from this, or at least some food for thought in the future as we look to address these important public health issues.
Absolutely. So, housekeeping items, everyone. Thank you all so much for listening or watching this. Be sure to subscribe if you have not as yet. Leave a review and share it with a friend. Greatly appreciate you all. See you all next week. Peace.